Hi, I'm Dr. John Ganser, Medical Director of Western Bariatric Institute. I'd like to welcome you to our website and thank you for visiting us. So we're going to talk a little bit about Western Bariatric Institute, our comprehensive program we've set up for you, a little bit about the obesity epidemic, weight loss surgery and options for surgery, and then at the end we'll tell you where to go from here and who to contact. First of all, safety is our number one concern. Bariatric surgery has become one of the most researched topics in medicine and has become very safe as a result of efforts by the ASMBS and the ACS. They closely scrutinize and certify programs in order to assure safety. We received our first certification as a Bariatric Surgery Center of Excellence in the year 2005 when it was first established. Western Bariatric Institute was established in the year 2000, and we have put together a very comprehensive program based on our long experience as well as from patient input. There are many people who make us successful and support you along your journey. You're not alone. The obesity epidemic affects many Americans. More than 68% of adults are overweight or obese. More than 32% of children are overweight or obese. Well over 6% of the adult population is considered morbidly obese and felt to be a candidate for bariatric surgery. The medical costs of obesity are staggering, but the most important issue is obesity-related deaths that occur annually. Over 325,000 deaths are attributed to morbid obesity in the United States annually. Obesity rates are climbing in the United States at a staggering rate as displayed in this slide. When we talk about obesity, we can't just say how much you're overweight. We really have to take your height into consideration. A formula called the body mass index does this. Tables like this can give you your body mass index, or you can look online for a BMI calculator. There are clinical terms used to describe people's levels of body fat to see if they are candidates for weight loss surgery. The ideal BMI ranges from 18.5 to almost 25. If your BMI is between 25 and 30, you're thought to be overweight. If it is between 30 and 35, you're considered class 1 obese. From 35 to 40, you're a class 2. If your BMI is over 40, you're said to be class 3 or extremely obese. Class 3 obesity is considered morbid obesity, a term you might be more familiar with. Extreme obesity is called morbid obesity because this degree of excess weight may considerably reduce life expectancy and is associated with an increased risk of developing conditions or diseases such as diabetes, high blood pressure, joint problems, etc. Almost every organ system is affected by morbid obesity. The bottom line, though, is early death, and that's something we'll focus on towards the end of our talk. This slide outlines the association between obesity and health risk. It's clear that as your weight rises, your risk of not only diseases goes up, but your risk of dying goes up as well. Well, let's look at some of the causes of obesity. Obesity is obviously an imbalance between energy intake and energy expenditure, but it's not quite so simple. There's a lot of things that play into why some people are overweight and some people aren't. Everyone has friends who eat poorly and don't exercise, yet they're thin. So why is this? This is something that we'll try and explain. Everyone's tried dieting. Diets work initially. You do great for a little while, but then it seems like as soon as you turn your back on it, the weight comes back, usually with a little extra. This slide outlines some of the best approaches to medical weight loss, association with psychological input, nutritional input, very controlled studies, and yet still patients are unable to keep the weight off with diet once the body mass index gets over about 30. Well, obesity isn't so simple, like we've said. It's a multifactorial disease. Genetics play into this. Our environment plays into this. Our behavior plays into that. And they don't work independently. They really work together. You might have the genetic predisposition in your family, and yet when you're young and exercising, you don't have any problem with weight. It's later on in life when you get a knee injury that you can't exercise, or some other factor plays into this. The bottom line is obesity is a metabolic disease. There are hormones in our body that are supposed to control our weight and maintain a normal weight. And this is where the problem really happens. So I'd like to try and simplistically explain some of these factors. Well, the classic way to look at how bariatric surgery works is that you reduce food intake, the weight will go down. But there's clearly much more to that. The modern view is there are a lot of other inputs, endocrine, neuronal, lots of inputs to help control our weight. This is kind of a complex slide, but it kind of describes some of our energy balance issues associated with obesity. As you can see in the red line, as basal energy expenditure decreases and energy intake increases, the body mass index increases. The problems that happen with these hormones that we have is they go haywire and they're maintaining your set point for weight at too high of a level. With bariatric surgery, we're able to alter that set point so that we can now increase basal energy expenditure while we're decreasing energy intake, and that pushes your body mass index towards the normal level. So there are a lot of things going on behind the scenes more than just limiting calories with bariatric surgery. Let's look at some of the surgical options for the treatment of obesity. There have been many surgeries that have come and gone through the years, some of which worked great initially but maybe had some side effects to them. The good thing about modern bariatric surgery, it is very science-based. We don't do anything without a lot of good, valid research. Today, we perform laparoscopic gastric bypass surgery and laparoscopic vertical sleeve gastrectomy, two of the most common surgeries done worldwide. Well, a revolution happened in bariatric surgery about 20 years ago when we started doing bariatric surgery laparoscopically or with small incisions. There's great advantage to this. The bottom line is it makes the surgery much safer and much easier to recover from. Roux-en-Y gastric bypass surgery has been around since the 1960s. We've been doing this laparoscopically locally since the year 2000. This is a surgery that makes a small stomach pouch, but also reroutes the intestine and bypasses part of the bowel. It's been very effective in patients with diabetes as well. This has been the gold standard since the early 1990s. Well, let's look at some of the advantages and disadvantages of gastric bypass surgery. One of the advantages, as we discussed, is that there is good resolution of diabetes. As many as 83% of patients will get off all of their medicines for diabetes. There's fairly rapid initial weight loss and improvement in other health issues. This is a very good treatment for GERD, or gastroesophageal reflux disease. There's no implant required, and again, this has been around for a very long time in the United States. One of the disadvantages of the surgery, it is technically more difficult, but we've got a vast experience in this and made this a very safe surgery. There are risks of complications as time goes on with this, such as hernias and bowel obstruction, and also risk of ulcers. It's important that you avoid any kind of medications that might put you at risk for ulcers. This is something we review with you at your visit. There's also risk of vitamin and nutrition malabsorption. We instruct you very extensively about what kind of vitamins and nutrients you need to be healthy. One of the most common surgeries performed today is the vertical sleeve gastrectomy. We do this procedure laparoscopically. It's a restrictive procedure in that we reduce the amount of food you can take in, but it turns out there's a large hormonal input as well. There's a hormone produced in that part of the stomach that we remove that's responsible for your set point for weight. This is that anti-starvation hormone we were talking about earlier. By getting rid of that, it helps us reset the set point for weight. One of the big advantages of sleeve gastrectomy is it's a very safe procedure. There's also much less problems with vitamin and nutrient absorption than there is with Roux-en-Y gastric bypass. As you can see from this slide, many of the health issues associated with obesity are well treated by weight loss surgery. One of the most important is diabetes. As many as 83% of patients will get off all of their medications for diabetes after weight loss surgery. Many of the other health issues are well treated as well, such as high blood pressure, high cholesterol, gastroesophageal reflux disease. Well, there are potential complications with any operation. We take these very seriously and have made these very safe surgeries. Some of the complications that can happen with any surgery, such as infection and bleeding, very low risk in these operations. They're done laparoscopically with small incisions, making them much safer. There's a lot of misconceptions out there about the risk of bariatric surgery. While in the remote past these were very risky surgeries, as you can see from this slide, we've made these very safe surgeries. Safer than many surgeries people take for granted that think have very little risk to them. As a result of our efforts and our experience, we have a very low complication rate. Well, let's look at the risk of not doing surgery. This is a very incredible study. It's out of the Swedish obesity study where they studied outcomes after bariatric surgery, and this was specifically gastric bypass surgery. They showed over the course of 5 years a marked reduction in the chance of dying after weight loss surgery. Patients were dying of heart disease, diabetes, and all sorts of complications that are improved after weight loss surgery. There have been many studies that have shown an improved survival after gastric bypass and sleeve or any kind of bariatric surgery. Weight loss, like we talked about, carries a high risk of medical complications and even death. Well, there have been many studies that have shown a reduction in death rate and chance of dying after the surgery because of the resolution of a lot of the health issues associated. Your commitment to improving your health is critical to the long-term success of surgery and the weight loss process. You must be able to commit to following all of our instructions in preparing for your surgery, using the nutritional education and applying it to your diet. We have support groups for your benefit. We'll instruct you about how important physical activity is to maintaining weight loss. This is something you can do, and you must take control of your health. We always love before and after pictures. We've got lots of very successful patients. We've performed thousands of operations. Rock lost 115 pounds after gastric bypass surgery. Kim had the vertical sleeve gastrectomy and has lost 120 pounds. She used to have to walk with a cane, which she no longer uses. Kristen has lost 140 pounds from gastric bypass surgery and couldn't be happier. Lynn, over 95 pounds with the sleeve gastrectomy. She's been able to increase her activities, enjoy time with her kids. Well, where do you go from here? Well, let's get started today. You're on our website. Feel free to click on the box to request an insurance authorization. The phone number is listed here. We'll get you to the person that you need to set up your consultation with one of the bariatric surgeons. Thank you very much for your patience and your attention, and we look forward to seeing you.